Okay,
Okay.
I'm going to perform my hand hygiene. Hi, my name is Charlotte. I'm going to be your student nurse today.
Hi, Charlotte.
Today I'm going to be performing a head-to-toe assessment on you.
Okay.
It's going to take no longer than 15 minutes. Do you have any questions?
No?
Okay, can you please verify your name and date of birth?
Sure. Catherine Yaley, 32966.
Perfect. Do you have any allergies?
No.
And are you experiencing any pain right now?
No.
Okay, the patient's not experiencing pain, but if they were, I would use the PQRST scale to further assess. Okay, the patient's, upon general appearance, has good posture, normal affect for the situation. The patient has no obvious deformities. The patient smells fine, has proper hygiene, and their mood seems to be normal. Moving on, I'm going to assess your skin and nails.
Okay.
I'm going to roll up your sleeves.
Okay.
The patient's skin is warm and dry and pink, which is normal findings. Next, for your legs. The patient's skin is also warm, dry, and pink, and the arms and legs were both symmetrical, texture, color, and temperature. Next, I'm going to assess your nails. The nails are a normal color. The capillary refill is less than 2 seconds, which is normal findings, and there are no signs of clubbing. Next, I'm going to assess your skin turgor. Skin turgor is normal. Okay, moving on to the neurological assessment. Can you please tell me your name?
Catherine Yaley.
And where are you?
I'm at home.
Why are you here?
I'm getting an assessment from my nursing student.
Okay, and what is today's date?
October 17th, 2024.
Patient is alert and oriented ×4 and also has proper speech. Can you please tell me if you can hear this evenly on both sides?
Yes.
And do you have any hearing loss or do you wear any hearing aids?
No, no loss, no aids.
Okay, perfect. Now I'm going to assess your eyes.
Okay.
Just look straight ahead.
Okay.
Patient's pupils are equal, round, reactive to light, and accommodating. And can you please smile for me and raise your eyebrows? Patient's face moves symmetrically and normally with facial expressions. Okay, moving on to your nose, mouth, and throat. Going to look up your nose.
Mm-hmm.
Patient's nose is normal, symmetrical with no nasal drainage. Patient's lips are a normal color, pink. Let me look in your mouth.
Mm-hmm.
Okay, can you say ah?
Ah.
Patient's oral mucosa is moist and pink, and uvula responds to verbal stimulus, and the teeth are normal and symmetrical and aligned. Lastly, I'm going to check your trachea. Trachea is aligned, which is normal findings. Moving on, I'm going to listen to your breath sounds. I'm going to listen to 6 locations on the front, 6 locations on the back, and 2 laterally. Just breathe normally.
Okay.
Okay, and then I'm going to have you turn this way.
Okay.
I'm going to go up your shirt to listen to the posterior sounds. Okay, and then I'm going to have you lift your left arm. And then lift this arm.
Sorry.
The patient's breath sounds are all equal, normal, with no adventitious noises. Next, I'm going to assess your lung expansion. If you could turn this way.
Sure.
Take a deep breath. Patient's lungs expand normally. Patient does not seem to have any difficulty breathing. Do you have any pain or difficulty when you breathe?
No.
Okay, patient breathes normally, which is normal findings. Okay, next I'm going to assess your cardiovascular system.
Okay.
I'm going to listen to 5 locations on your heart.
Okay.
Okay, the patient's heart sounds sound normal, and now I'm going to take your 1-minute apical pulse. Okay, the patient's heart rate and rhythm sounds normal, and her heart rate is 68, which is a normal range. Next, I'm going to assess your radial and pedal pulses. Radial pulses are even, +3 and strong, and then I'm going to have you take off your shoes and socks. Okay. Patient's pedal pulses are strong, +3, and symmetrical in both feet. Next, I'm going to move on to your gastrointestinal assessment. So if you could lay flat on your back. Patient's abdomen looks symmetrical, normal color for their skin tone, and there is no obvious signs of distension. Are you experiencing any abdominal pain?
No.
When was your last bowel movement?
This morning.
Okay. Okay. I auscultated the patient's abdomen from right lower quadrant to left lower quadrant, and there were bowel sounds in all 4 quadrants. You can sit back up.
Okay.
Okay, and then I'm going to have you walk here and back to assess your gait.
Sure.
Okay, the patient's gait looks normal, and they do not limp or have any issues with walking. Mobility looks normal. Next, I'm going to have you squeeze my hands.
Okay.
Okay, and then pull and push. Okay, upper extremities are both strong and symmetrical in strength. I'm going to have you pull your legs back and then push forward. Okay. Patient's legs are symmetrical and strong in both legs. And then finally, I'm going to lock the patient's bed in a low position with 2 bed rails up. Make sure their call light is within reach. And is there anything else I can do for you?
No, thank you.
Okay, I'm going to do my hand hygiene and I'm all done.